Hello, sir. Could you share your screen?
Yes.
Dr. Ravi Prakash, he did his Bachelor of Dental Surgery from College of Dental Sciences and Hospital, Davangere. He did his Master's in Krishna Devaraya College of Dental Sciences and Hospital, Bangalore. He started his academic career as senior lecturer in Sri Siddhartha Dental College. He's presently working. Uh, He's presently working in Guru Nanak Institute of Dental Sciences as professor and PG guide, and he has a total of 12 years academic experience. He did a comprehensive course on implant dentistry under the auspices of the faculty and staffs of New York University College of Dentistry. He has done many publications, paper and poster presentations, and have given credentials for the same. I welcome you, sir. And his topic of presentation is tunnel and pouch technique in the treatment of gingival recession, a case report. Over to you, sir.
Thank you so much, Dr. Sumevar, for the kind introduction. And good afternoon to one and all. And myself, Dr. Ravi Prakash. I'm working as a professor in Department of Periodontics, Guru Nanak Institute of Dental Science and Research, Calcutta. It's in West Bengal, India. And today my topic of presentation is tunnel and pouch technique in the treatment of gingival recession. Okay, I'll be presenting a case report regarding this. And first to that, a warm regards from my college, Guru Nanak Institute of Dental Science and Research, which is a part of a prestigious JS group of institutions. And coming to the presentation, coming to the introduction part, okay, one of the most common aesthetic concern associated with the periodontal tissues is gingival recession. Because see, as we all know, okay, the oral cavity, I mean, like it is one of the most aesthetic part, okay, which, I mean, whenever you smile or whenever you talk to someone, the main part which is visible is the teeth and the gingiva, okay, and the most concerned part of the diseases of the gingiva is a gingival recession, which affects the aesthetic part of the gingiva. And gingival recession, it is the apical migration of the gingival margin to the cemento-enamel junction. So what are the consequences of the gingival recession? Okay, it can be, first of all, yes, the aesthetic part, most concern for the ladies, okay, though for the gents also, but the ladies are more concerned about the aesthetic part, because in case of any gummy smile in a patient or in any individual, okay, the gingiva is more visible, and if there is a recession in the gingiva, then the root exposure will be there. And in case of the root exposure, when the cervical area, there will be a thin amount of cementum, okay, and due to the erosion of the cementum, the underlying dentin will be exposed, and again dental hypersensitivity will be there. And the caries means the cemento-enamel junction. It is, I mean, the most prone area for the deposition of your plaque and calculus, which in turn leads to the caries. Also, the gingival bleeding, okay, which is again due to the plaque and plaque retention. So, what is the etiology? We need to know about how the gingival recession occurs first. There are various etiologies, like starting with let's start with the tooth brushing only. Okay, the tooth brushing, I mean, like the over enthusiastic patients, okay, to keep their oral hygiene properly, use some hard bristle brushes or brush their teeth vigorously, okay, for more amount of time, which may lead to the erosion of the gingiva and exposure of the root. And high frenal attachment, yes, it is one of a perioesthetic problem, wherein the high frenal attachment which pulls, okay, the marginal gingiva down, I mean, apically, leading to the exposure of the gingiva, I mean, the root, and the position of the tooth, okay, when the tooth are not positioned in the line of the occlusion, or it is placed in the more buccally or more labially, okay, the amount of the bone will be less, okay, because the gingiva follows the contour of the bone. When the amount of the bone is less, then in that area you will have the amount of the gingiva also less, which leads to again the recession part. And then tooth movement by orthodontic forces, again it is due to the same, the position of the tooth, what I explained. Due to the tooth movement of the orthodontic forces, there will be the amount of the bone loss will be there more, and then which leads to the gingival recession. Improperly designed impartial dentures, wherein the clasp will be given for the retention of the partial dentures, which can impinge on the marginal gingiva, which can further lead to the recession of the gingiva. Yes, smoking is one of the prominent cause of gingival recession, and restorations also, improper restorations or overhanging restorations, which may lead to impingement of the gingiva directly, or which is also one of the large retentive factor, which in turn can cause the inflammation of the gingiva. And calculus, yes, it is one of the most common cause which is involved in all of this. Okay, whatever I mentioned. Next, coming to the treatment part. What are the treatment options for the gingival recession? See, we can do the restorations, crowns, and veneers, okay, for the gingival, or the construction of the gingival mask. I mean, the artificial gingival mask can be constructed with the acrylic or over the gingiva with exposed root surface. And the frenectomy, in case of high frenal attachment, we can do the frenectomy, removal of the frenum, or we can treat frenum. And the main approach of the treatment is through the surgical root coverage procedures, which includes many, like free gingival autografts, okay, free connective tissue graft, pedicle autografts, subepithelial connective tissue graft, guided tissue regeneration, and pouch and tunnel technique is actually, it is not exactly a graft. It is a technique wherein we use the connective tissue graft, okay, to coverage the recession area. So next, coming to the pouch and tunnel technique. So how, I mean, like in the schematic diagram, I will just try to explain how it is done. Then later I discuss the case report. So first, see, partial thickness circular incision means here when there is more number of recession is there. Okay, so we just raise the partial thickness without involving the papilla. Okay, the papilla will be intact, and we just undermine the attached gingival area through the sulcus area. Okay, and then the first suture is introduced to the most distal recession. It passes through the tunnel. Okay, like here you can see it passes through the tunnel from here through all the tunnels prepared in the recession areas, and then the second suture, okay, is placed on the opposite side of the tunnel in the same manner as the first. It exists through the same recession of the first suture, and then the both ends are tied to the graft, okay, and the graft is pulled so that the connective tissue graft is it's placed on the recession area created where we have created the tunnel. So what are the indications for tunnel and pouch technique? Okay, so Miller's class 1 and class 2 gingival recession, we know that the Millers have given the 4 classes of recession. In that class 1 and class 2 recession, we do pouch and tunnel technique, and lack of adequate tissue for the lateral sliding flap means the lateral pedicle graft means we take the graft from the adjacent tooth, okay, to cover the root coverage, to cover the exposed root surface when there is no adequate tissues. And in case of multiple recessions also, we cannot attempt the lateral pedicle graft. So we do pouch and tunnel technique, and presence of multiple and wide recession, as I said, and increased recession in area where aesthetic concern is of great concern. Because see, most of the time the anterior area is more concerned about the aesthetics, and the recession is also most commonly seen in the anterior area. So in those cases, this treatment option is best, okay, and exposed root sensitivity. Next, coming to the case report, okay, a 38-year-old non-smoker male patient reported to the Department of Periodontics, Guru Nanak Institute of Dental Sciences and Research, with the complaint of sensitivity, okay, in relation to the upper anterior tooth. So, this is the preoperative pictures showing the first quadrant of the patient, wherein you can see class 1, this is the Miller's class 1 recession in relation to the lateral incisor, and the distance from the CJ to marginal gingiva was 2 mm. And then, so Miller's class 2 recession in relation to 1, 3, 1, 4, and 1, 5, and the distance from the CJ to the marginal gingiva was 3 mm. So width of the attached gingiva was also inadequate, okay, in the region of 1, 3, 1, 4, and 1, 5. So this is the intraoperative procedures wherein the root was planed, okay, the root was prepared before the tunnel was prepared. So, and this is the root biomodification was done, okay, it is to remove the smear area and the residual, whatever the microorganisms present on the root surface, which can, impinge or in the healing of the connective tissue graft which we place in the future. Okay, and this is the undermining incisions we give through the sulcus without disturbing the papillary connection, the labial and the palatal papillary connection. And pouch and tunnel are created and extended beyond the mucogingival line. You can see the instrument has been inserted through the pouch, the tunnel created between the roots, okay, intact and detached from the underlying bone. So the donor site, normally we take it from the palatal area, okay, through the trapdoor preparation. So this is how the graft is placed in the tunnel prepared. Okay, one end of the pouch is tied with the suture material, and the other end will be, from the one end it will be pulled. Okay, so that the connective tissue graft is placed in the tunnel prepared. So the entire complex, okay, means which includes your the buccal gingiva, the interdental papilla, and the connective tissue graft, okay, was coronally advanced, means was pulled, and okay, and anchor suture was placed. Anchor was placed on the labial surfaces of the anterior tooth and the premolars, okay, by the composite, and then it was the tissues were pulled, and then it was sutured for better healing and avoiding the dislodgement of the graft placed. So this is the 15 days follow-up, okay, photographs wherein we have achieved a good amount of healing. And this is 3-month post-operative where we can see a proper, adequate amount of width of attached gingiva also, and also the coverage of the root which were exposed. So this is the results, okay, and this is the pre-operative photographs, and this is the post-operative 3 months photograph wherein we can appreciate, okay, even see the aesthetic concern also, was addressed in this situation wherein the patient doesn't have the complaint of the aesthetic also, or the exposed root also, and he won't be having any sensitivity issue also in this case. So healing was satisfactory, and acceptance, acceptable decision coverage was there, and there was an increased color match. See, whenever the connective tissue graft is used, okay, in the coverage of the root surface, there will be a increased color matching and good amount of attached gingiva. Yes, it is regained. So coming to the conclusion of my case report, the most critical factor of root coverage procedures is the technique's predictability. More post-operative time is required for follow-up for this case to see the predictability of the treatment outcome. And the takeaway message is, as we all know, in this pandemic situation, we are waiting for the vaccination to come. Okay, but for the gingival recession, as such, there is no medicine or vaccination to prevent the gingival recession. Okay, so prevention is better than cure. Early detection by maybe a general practitioner or a specialist like a periodontist or any kind of a specialist. Early detection we can prevent the gingival recession to occur more, so that in the initially only we can do the treatment. And these are my few references, and I thank you all. I thank first of all Dr. Arun for giving me this wonderful opportunity to be a part of World Dental Conference as a guest speaker. And also thank Dr. Nashra and Dr. Sumeva for coordinating the program so much, very successfully. And thank you. Over to you, ma'am. Thank you so much.
Thank you so much, sir. That was very interesting and informative presentation. Would you like to add up something, sir?
That's it, ma'am. I look forward because, see, to be very frank, ma'am, this is my first experience in the World Dental Conference. Okay, so in the virtual conference only, I had a very nice experience. So I wish I would, and I will definitely in future physically attend the World Dental Conference from now on every year. And thank you for giving this opportunity. And in any kind of queries or questions, yeah, kindly revert back. No issue.
Thank you so much, sir. If any queries or questions, we'll definitely let you know, sir.
Sure, ma'am. Thank you so much.
Thank you so much, sir.